Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
General properties of antiarrhythmics. The general properties of antiarrhythmics mainly includes first we have these antiarrhythmics will suppress the conduction in fast conducting cardiac tissues. In fast conducting cardiac tissues, these will suppress the conduction. They will also reduce the conduction or suppress the conduction in aberrant tissues also, like heart. For example, if there are ectopic pacemakers or if there is born sorry if there is wolf parkinson's white syndrome, there will be presence of aberrant tissues, so in them also it will suppress the conduction. This antiarrhythmics will prevent the re-entry pathways if they are present, because re-entry pathways are actually the most common mechanism of causing arrhythmias in many types of arrhythmias. Then they will also reduce the automaticity of the heart, and they will also bind to the sodium channels tightly in the presence of ischemia. Then all of them except lidocaine also have pro-arrhythmic activity. All have pro-arrhythmic activity except lidocaine. So these are main general properties of antiarrhythmics.
thank you and thank you for watching.